Frontline workers and representatives are speaking at Queen's Park today to address the impacts of the province's policy to close safe consumption sites in Toronto.
One person dies every 2.5 hours from the toxic drug supply in Ontario. Since Ford took office, 21,000 people have died. We went from 2 people dying a day to 9.
Last week, Ontario Premier Doug Ford announced a new policy that will restrict these sites from operating within 200 meters of schools and childcare centres. This policy will force the closure of many of the consumption sites in Toronto. Meantime, Ford has defended his position in closing the 10 consumption sites.
First of all, I think they should be very grateful. We just announced, I think it's $376 million. Never been announced before to make sure we help people out, get detox beds, rehabilitation, and getting them back on their feet, making sure we have proper housing for them, job opportunities. And we're going to be there to support people.
This government has failed Ontarians by not investing in the same system he wants people to voluntarily access when they can't even get into it. We all don't have $40,000 like his family.
I'm not a fan of the federal government's safe supply. I compare it to giving people poker chips, dropping them off in front of the casino and saying, go to town. Or give them all free pass to LCBO all day, all night. That doesn't work, folks. I know. I've dealt with it within our family. I've dealt with it within our community. That does not work. What works is rehab, detox beds, supporting these people with good paying jobs. Housing is absolutely critical. And there's a whole row of things. Not just ignoring it.
His sister used opiates prior to the toxic drug death crisis. If his sister was using drugs today, if she did not have access to a clean, safe supply, most likely she would have overdosed or be dead, which is a really shocking and horrible thing to say, but it's the reality of what we're living in. And she had access to methadone, and she has a well-off family. When his brother went to treatment, he got to pay $40,000 a month to go to that treatment center and probably got the best treatment he could get, including having access to paying out money for any kind of therapy. But he also ran the city of Toronto. You know, drug users are capable of doing many, many things. You know, whether people like Rob Ford or not, he was using crack cocaine and he still ran the city. The crack cocaine market has never been volatile. It's never been at risk of killing people. So when Doug Ford says that, you know, we're not making policies off the basis of our own families. We're making policies off of evidence, and we need to be using that evidence. That struggle does not get to be weaponized against everybody else because his family had a certain period of time and they used a certain drug.
I wonder if Doug Ford has seen an overdose, what it looks like. I wonder if he's seen a dead body that's overdosed, because I have. Supervised consumption sites provide a first point of care for many who need a place to manage their substance use safely with the support of empathetic and non-judgmental workers.
The Ford government's new policy on supervised consumption sites is being framed as a move to protect our children and ensure community safety. But let's be clear, this policy is not about safety. It's a calculated attempt to shut these critical sites down, which it is effectively doing.
If we are concerned about public use, drug use, and needles on sidewalks, then what we actually need to do is scale up these services so that people have somewhere to go. My friend Pierre died in 2017 in a KFC bathroom. Is that what we want? I'll add that this is emotional labor that we're now putting onto people who are not qualified to do this work. We are now potentially putting the heavy emotional labor on KFC workers, coffee shop owners, TTC transit workers. Is that what we're really pushing for?
My opinion, you just keep handing people needles. Or like I said on my last press conference last week, the federal government, imagine going into a place at any given time. You can get in, the drugs you want. You go out on the street, and this happens. They sell those drugs, and then they buy harder drugs. It's a fact. It's not make-up stories here. This is exactly what's happening. I believe in rehabilitation.
They are handing out death sentences, but disguising them as care for people who are using substances, disguising them as treatment facilities, and disguising them through an insulting number of supportive housing beds. 375 beds. In Toronto, there are 10,000 people sleeping in shelters. This is also a disgusting approach to trying to deal with homelessness. Ford has never invested in housing. The government says that closing the sites is about encouraging treatment in the form of rehab centers. But treatment is a spectrum, and truly what we need treatment from is treatment from state abandonment. Rehabs are often privatized, and the reality is that putting rehab versus safe consumption sites as a dichotomy, as a false binary. We need both.
Other people have their opinions, but I've seen what works and what doesn't work. In my opinion, it's a failed policy.